Dr. Melissa McRae from Vitality Natural Wellness and Med Spa. We have offices in Mansfield, Powell, and Delaware. Super excited about the launch of Delaware, seeing our first patients next week. So if you're not familiar with us there, feel free to reach out and we can get you set up in that space. Today, I want to talk about the often neglected state of perimenopause. Everybody seems to know about menopause, right? You haven't had a period for 12 months and you are officially transitioned, menopause, right? And then we think about the stages up until menopause. Well, there is this time of irregular periods, hot flashes, vaginal dryness, brain fog. All of these are super common signs of perimenopause. And this is the body's natural transition into menopause. Now, everyone's experience with perimenopause is unique, and so that's really important to keep in mind. There is no one-size-fits-all checklist of symptoms, but there are some telltale signs of perimenopause, and you might not be aware of those. So today, I really just wanted to talk about those a little bit, give you some information, and tell you what is typical to see in perimenopause, that you're not crazy, that what you're feeling is not just because you have too much on your mind or too much stress in your life. Perimenopause is an actual physiologic state. So perimenopause, this is the stage leading to menopause. It literally, peri means around in Greek. So perimenopause is oftentimes referred to as that menopausal transition because of that. It's a time frame that can last up to 12 years. So even though people use perimenopause and menopause interchangeably, that's not really true, because menopause is literally a single moment in time from there forward. And that is when a woman has not had a period for 12 consecutive months. Menopause is no period for 12 months. Now, females, if you have not had a period for 12 months and you have any spotting or bleeding after that, it is imperative that you see a provider. It is not normal to bleed after you haven't for 12 months. So keep that in mind. In menopause, you should no longer bleed if you're in a natural progressive state. Perimenopause, however, is this time leading up to menopause, and it can, again, take 10 to 12 years. The average woman spends about 4 years in perimenopause. During this perimenopausal time, hormones go crazy. So your levels of estrogen and testosterone and progesterone, all of those levels in the body really start to fluctuate. Some have a rapid decline, some decline dramatically, and then all of a sudden just will, have a big release of those hormones, and that can cause all kinds of symptoms. Those feelings of just symptoms fluctuating significantly can all be really related back to this hormonal change that's happening. Now, estrogen and progesterone are the main female reproductive hormones, but testosterone, of course, is also in that system of the hormonal cascade and has a crucial importance and crucial role in this whole hormonal transition. Now, not only do estrogen and progesterone help govern your menstrual cycle, how often you bleed, but they also play this key role in your health. So we're going to talk a little bit more about that today. And as you'll see, estrogen levels can affect mood, how well your brain works, bone health, and metabolism. Now, I don't know about you, but those are all kind of key areas of concern I have for myself, right? What can I do to help my mood? I want to be happy and joyful and peaceful and not feel anxious and not feel down. How well does my brain work? Like, what did I go into that room for? So brain fog and cognitive function and memory and focus and concentration. Of course, bone health. We know that if somebody has a hip fracture in their elderly ages, significantly increases their risk of death. I'd prefer not to have that happen sooner than later. And of course, metabolism, right? So how do we maintain our health and a healthy weight when we have all of this hormonal chaos in the background? So the start of perimenopause is not clearly defined, and it can vary from woman to woman. Again, this is a unique journey we all have. Usually starts in your 40s, but some women can enter perimenopause actually even in their 30s. I like to think that any female that I see in the practice who's 35 or older is in perimenopause, unless they're menopausal. So let's talk about some of those perimenopause symptoms. So the symptoms you can experience before you hit menopause. These signs and symptoms often creep in over time, and you may not notice them at first. You may also find it really hard to put your finger on what's causing them. a lot of times you might attribute them to other issues, right? But here's some of the most common symptoms we have. Irregular periods or heavy bleeding. Now, a change in your menstrual cycle, such as irregularity or getting very heavy, the first sign of menopause. These can be periods that happen too frequently, like you used to be regular and now every 2 to 3 weeks you have a cycle, or you could cycle every 6 weeks. Anything that's different from your norm is considered irregular. The other thing is oftentimes they start to get really heavy. Now, the problem is these are all based on hormonal changes, so it's not unusual. However, they can mimic uterine cancer. So if your periods get closer together or if they get heavier, you need to let your provider know, because we do have to monitor that. Perimenopause and uterine cancer act the same. Thankfully, it's almost always perimenopause causing the problems, but we do always check into that if your periods are getting closer together and heavy. But any irregularity in periods, it's the fluctuation of estrogen and progesterone that's causing that. And you might also notice some spotting between your periods. So unfortunately, it acts a lot like trouble. It is trouble, and it is very, very common. Next symptom you might have, hot flashes. So hot flashes are also called vasomotor symptoms. They're one of the most common signs of perimenopause. So hot flashes are they're these sudden waves of heat across your body and your face. Sometimes you can actually get profuse sweating from that. In women who have lighter skin tones, hot flashes can cause this red flushing that's very, very noticeable. They usually last anywhere from 1 to 2 minutes. Also, although sometimes they can be a little less frequent than that, although just a tidbit, if you have just a quick flush, that's usually testosterone. If you have longer than 2 minutes, that's almost always a hot flash, which is estrogen. So we get to help you kind of decipher all of that, but just know that this flushing is super common in perimenopause, and usually a hot flash. You can even get a rapid heart rate, so your heart rate can jump. You can get chills. It's super typical. Like 80% of women will get hot flashes during perimenopause. And these usually last for about 7.4 years, and sometimes can even be longer than that. Now, the causes of hot flashes, they aren't really that perfectly understood, but what we typically think's happening is the hormones are affecting the hypothalamus, which is the temperature control center of your brain. And during a hot flash, your hypothalamus thinks your body is too warm, so it dilates all of your blood vessels in your skin. And that causes, of course, your skin to feel very, very hot, but it's doing it in an effort to try to cool you. Regardless of the cause, because we don't know 100% for sure, we know that hot flashes happen in perimenopause and it can make women miserable. Let's talk about the next thing, changes in metabolism. So many women will have weight gain and changes in their fat metabolism during menopause. And this is, again, hormonal issue. So a drop in estrogen is also associated with changes in the levels of your good cholesterol. And we also see your bad cholesterol go up. And then it also addresses triglycerides. They get worse, and that's triglycerides are a type of fat in your bloodstream. This combination, we know, increases your risk of heart disease and type 2 diabetes. So although you might be worried about your metabolism in the sense that you're getting this little extra weight around your belly area you never had before, we clinically also worry about metabolism of cholesterol and blood sugar, which we see dramatic changes in the perimenopausal woman. So knowing that in perimenopause, we have to watch your blood sugars more carefully and your cholesterol more carefully, it's a fact to not just disregard this stage of your life, because we don't want to wait till things advance too far. We also know that eating certain foods that don't cause big spikes in your blood fats, your blood sugar, can lower your risk of heart disease that comes at an increased problem during this time. The other thing to keep in mind with metabolism is protein intake is crucial during this stage. Your muscle mass is naturally going to start decreasing at a pretty significant pace in some women. So really, really important to make sure you're getting adequate protein intake during this perimenopausal time. Loss of muscle is called sarcopenia, and we've talked about that a little in the past. Sarcopenia is a big problem because muscle is your health currency. If you don't have muscle, your risk of almost every illness substantially increases. So very important protein intake during perimenopause state. All right, so hot flashes, metabolism changes, mood changes. Let's talk about mood. Perimenopause can cause a significant change in your mood. Again, a lot of women think, maybe it's just a stressful time in life. A lot's changing for a lot of women, but women often find that this time of life and their perimenopausal place finds it really affecting their mental health. Anxiety and panic problems, panic disorders or panic attacks, irritability that comes and goes out of nowhere, feelings of low self-esteem, even depression, they're all a part commonly of perimenopause. They've done a lot of studies looking at mental health in perimenopausal women. And let's just say this, they're starting to do those studies. Traditionally, this type of information is incredibly lacking. Like if you're not a man, a typical white male, then studies haven't really been done much. So, the perimenopausal woman is a category that's finally starting to be studied because we're not men and our bodies work differently. So thankfully, one study found that women who rarely had anxiety in the premenopausal state were twice as likely to experience high anxiety during perimenopause. Women who had anxiety already, thankfully it didn't change much, but you get a lot of women who never had issues with depression or anxiety, and all of a sudden in this perimenopausal state, they're 2 to 4 times more likely to even get a major depressive episode. So we pay very close attention to mood and what a dramatic impact it has in your health. And we know that there's a lot of vulnerable women during this perimenopausal time. We know that estrogen has a huge impact in the brain that helps control mood. These, the so-called like feel-good hormones like serotonin, dopamine, oxytocin, and even noradrenaline, they're directly influenced by estrogen. So imagine as your estrogen drops, your stimulus for release of your feel-good hormones in other areas also drops. It can be a particularly overwhelming and difficult time in your life. You have physical signs of menopause. They can cause emotional distress for sure. And we want to make sure that the psychological impact, like anxiety and depression, don't add to that. Mental health can be affected by many different factors. So we pay very close attention to that vitality. Let's see what else. Perimenopausal women, vaginal dryness. Vaginal dryness, super, super common. The other thing is vaginal infections or vaginal discharges that they've never had before, urinary tract infections. Basically anything in that vaginal area can have a huge impact on someone's life. If you've never had a urinary tract infection, consider yourself super lucky. If you've never had any type of vaginal dryness, also consider yourself super lucky because they are not comfortable things to have. As your estrogen levels decrease, the vaginal mucosa and your cervix, they get drier. And if you can imagine, like, in the winter when you have dry, cracked skin on your hands, having dry, and think of dry, cracked skin in your vagina, and then think about having sex or using a tampon, or even when you go to wipe after using the restroom, can have significant impact in your life. We do a lot of sexual wellness at Vitality, and vaginal dryness and decreased libido, even joy and pleasure during intercourse or ability to have an orgasm. We see a tremendous drop in the perimenopausal ages, and it's amazing the things that we can do to help benefit that. So all of these things I'm talking about are not like doom and gloom, right? When you listen to the body and we know what a healthy or optimal state is, we can reverse so many of these things and create a really vibrant place in your life, not only physically, but emotionally. So if you've got vaginal dryness, if it's affecting you in your life, we can make it better. Okay, so let's talk about brain fog. Brain fog in the perimenopause time. What is that? It's really changes to your memory and focus and concentration. We call this brain fog. Now, I can't tell you how many women come in here and will say, I think I have dementia because I can't remember anything anymore. Well, the good news is so much of this is related to your hormones, right? So estrogen, progesterone, and testosterone, they are all crucial for cognitive function and memory. So there's not enough data to say how all of these changes happen, but we certainly know that as those drop, all of the cognitive functions decline to some degree. Now, you might also have these cognitive changes not only with brain fog, but things like poor sleep. Of course, we've talked about anxiety and hot flashes and mood swings. If those are all happening, they're also going to make brain fog worse because your quality of rest, your ability to heal and repair, those are all not happening. So perimenopause contributes to brain fog because of hormonal changes. And then the hormonal changes, what they cause, also creates more issues with brain fog and cognitive function. How about incontinence, right? Any ladies out there have noticeable leaking when they cough or sneeze they never used to have, or your kids say, hey, let's go jump on the trampoline. And you're like, I'll be right back. I'm gonna use the restroom first. During perimenopause, the pelvic floor becomes weaker and makes you a lot more susceptible to bladder leaks. So about 68% of women in the SWAN study reported issues with urinary incontinence. So it may be a more sudden onset urge to go to the bathroom, or it could be like stress incontinence, which is again when you cough or sneeze. These are all very, very common, but we have a lot of options to actually make those a lot better. So let's talk about what can we do about perimenopausal treatments, right? It's a natural stage of life, but it can also be overwhelming. Again, I 100% believe the perimenopausal woman is a neglected a neglected stage of life. So we're here to focus on that. There's a lot of treatments that we can do that can help you manage these symptoms through the stage, or even return those symptoms back to a place where they don't exist anymore, so that you can live optimally and vitally in your life. One of the main things that you can do is hormone replacement therapy. This involves taking a form of estrogen or progesterone to replace your body's natural hormones. We also work a lot with testosterone because it's another one of our sense of well-being, sense of feel-good hormones. It can be in the form of pills, patches, pellets, gels, creams. So there's a lot of different options there. And contrary to what a lot of people believe, you don't have to wait till your period stop to start hormone therapy, because we see those drops and we see all those symptoms related to hormone therapy, related to hormone fluctuation very early in the perimenopausal state. Very important to follow with your provider, because how those hormones are metabolized is crucial. We don't believe in a one size fits all. So we don't just give people one dose of a medicine and say, here you go. Hormone replacement therapy is it's an intricate form of therapy, and it's crucial that you're seeing somebody who truly understands the hormonal cascade, the influence of the hormones, what risks and benefits they offer, how they're metabolized, and how your body in particular responds. So very important, if you're getting hormone therapy, to go to somebody who's an expert in that, not who just does the typical flow sheet of your menopausal, so take this hormone, but somebody who innately will listen to your body and know what your body is needing. What else can we do for perimenopause? Well, there's a lot of different things. Lifestyle changes can actually make a huge difference. So exercising regularly, it helps improve mood and sleep, helps maintain your muscle mass, which of course is metabolically one of those things that can keep you healthy in times of illness. Getting adequate sleep. This is really, really important for your health. So we also know that sleep is a direct correlation to the foods you eat. So how your body responds to food impacts your sleep. We know that going to sleep 30 minutes earlier, even if you can't sleep as long throughout the night as recommended, going to bed 30 minutes earlier can actually help with unhealthy blood sugar spikes the next day. So there's some cool things about sleep. Smoking cessation, of course. We know that smoking increases hot flashes. We have over-the-counter vaginal lubricants and moisturizers that can be done. Caffeine is a big trigger for hot flashes typically. It also makes incontinence worse and can make vaginal dryness worse. So what are my takeaways? We've covered a lot of information here. Common signs of perimenopause include weight gain, hot flashes, irregular periods, vaginal dryness, mood changes, and metabolic changes. Perimenopause is also linked to a higher risk of diabetes, type 2 diabetes, as well as heart disease and even osteoporosis. You can manage perimenopausal symptoms through hormone replacement therapy, or even by changing your diet and exercise. To an incredible degree, we can have a dramatic impact on your perimenopausal symptoms. Changing eating habits can be especially beneficial during perimenopause, and not only can it help manage your symptoms, but also reduce your risk of diseases as you continue to age in a healthy and vital way. So just know, entering perimenopause is a healthy and normal part of every woman's life, but it can be a tumultuous time. So now is better than ever. This current timing is better than ever to really learn more about your body, prioritize your well-being, and work with somebody who's going to listen closely to what you're experiencing, know exactly where we need to work to optimize your body, and know that you do not have to just be miserable during this time, that there's a world of wonderful, natural, healthy ways to get you back to where you're feeling fantastic and not suffering through this time. And make sure